Hi friends, thank you for tuning in to the Concussion Coach Podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi friends, welcome back to the Concussion Coach Podcast. Before I introduce my guest today, I just wanted to make sure that you all know about the free guide that is available on my website. It's the 5 best ways to support your loved one dealing with a concussion. If you have a friend or a family member who is struggling with post-concussion symptoms, or if you're the one struggling and would like your loved ones to know more about what you're going through and how they can help, head over to my website, www.theconcussioncoach.com, and download the free guide. I am so excited, genuinely excited for this conversation today, not only because the topic is extremely important and something that I've been wanting to really focus on the podcast for a long time now, but because I get to hang out with my uncle. I get to introduce you to my fabulous Uncle Don. He is a sleep expert, and I'm going to read his bio, which is long and impressive and super interesting. He is a fascinating human. So be excited to hear from this amazing man. So Dr. Don Watenpaugh is a scientist, sleep clinician, data artist, and poet. He earned his PhD in physiology at UC Davis. His research career includes work in academia, NASA, and the U.S. Navy. His publications cover a wide range of topics, including fish toxicology, human sleep, exercise and environmental physiology, and biomedical engineering. A PubMed research of Watenpaugh D shows much of Don's publication history, and some of his work is also available on ResearchGate. Don is ABSM certified in sleep medicine and directed a large urban sleep clinic for 13 years. He cared for patients and managed the sleep clinic and laboratory. He presented research and provided continuing medical education to other caregivers at regional, national, and international conferences. He is an adjunct faculty member in the Department of Physiology and Anatomy, University of North Texas Health Science Center, and in the Department of Biomedical Engineering, University of Texas, Arlington. Don also creates customized data-driven graphic art and poetry. Everything generates data constantly. Individuals, families, organizations, businesses, cyberspace, competitions, ecosystems, celestial bodies, everything all the time. At Studio Videnda, he works with clients to create static and living art using data from whatever they find important or compelling. See, guys, he's amazing. So fascinating. So thanks for being here, Uncle Don. I'm excited to hang out with you.
Oh gosh, Bethany, thank you so much for this invitation to speak on this important topic today. And just really honored to be here and excited about what we're going to talk about.
Thank you. I feel the same way. So excited. Why don't we start off by you sharing a little bit of kind of an overview of how you got into the sleep field, what got you interested in it, and what was rewarding about it for you?
Oh gosh, yes, I've been fascinated with sleep since I was a young man. Back then, I remember just almost being angry at having the need to sleep because it seemed to me to be such a waste of time. In a way, it is, but Bethany, it's also critically important that we sleep. It's arguably more important than, for example, diet and exercise. The brain prioritizes things according to need, and we can go without food. We've proven many people, if we can go without exercise, you cannot avoid sleep. You can try to stay awake as long as you want. Your brain will eventually say, we're going to sleep. It's that important to us. Mm-hmm. And I've been fascinated by that. And I just, after a pretty long scientific career in space physiology and exercise and other things, I was offered the opportunity to become a clinician, to see sleep patients, to learn sleep from the medical side of things as a PhD, which is very unusual. And I eventually took that opportunity. And for over a decade, I directed an urban sleep clinic and saw patients and just loved the experience. I learned so much. And if you'd have told me like 20 years before then, you're going to be a doctor someday helping patients with their sleep, I would have laughed in your face. And I came away just with this breadth of gratitude and experience about being able to help people with their sleep and circadian rhythms.
Mm.
Yes.
Yes. Oh, so important. Thank you. And I'm curious, I remember, I know that you worked with NASA, you were working on, was it exercise specifically for astronauts?
All sorts of things. I'm a multidisciplinary physiologist, but a lot of it was exercise, artificial gravity, ways to help prevent the deconditioning astronauts experience during long duration space flight.
Mm. So fascinating. So that was prior to the sleep stuff. You didn't study sleep with astronauts, right?
No, that's true. Good call. There was no crosstalk between those two scientific and
Mhm.
careers. Yes.
Okay, just curious. I
Mm.
wasn't sure when that all came about. So anyway, again, fascinating career history. I think it's so cool. And love that you were able to help so many people for such a long time in the sleep space. So and as I know from talking to so many people, and as uh, you are aware as well, sleep is a major concern for people who are dealing with post-concussion syndrome. And I hear all the time that people are struggling with either getting to sleep or staying asleep or sleeping way too much and never feeling rested. Since sleep is such a key factor in recovery and general functioning in life, this is a huge
Mm.
problem. So can we talk for a minute about why sleep is so commonly disrupted when someone has had a concussion? I think we want to throw this out there too. A lot of times, if sleep concussions just kind of amplify everything. So if sleep was already a concern for somebody, then I'm confident that it will be even more of a concern after a concussion. But even people who, slept great before, I almost said slept like a baby, but babies don't really sleep that well sometimes. So I don't know where that phrase came from. But people who slept really well before,
Yes.
often will have major sleep issues afterwards. So, yeah, can you tell us why that is?
Well, sure. You raise up a very important point. There are, in a way, two classes of patients we're talking about here. Those with prior sleep problems that then had a concussion, and then those who slept perfectly well, but then after a TBI, traumatic brain injury, and contact concussion, they then could not sleep well. And I'll just deal with the first or the second one first. The patients who slept well, but then they had a concussion. Concussion damages the brain. Hello, there's no news there. But
Right.
how and why, and how does that interact with sleep?
Mm,
Well, concussion causes inflammation, among other things in the brain, and that can increase pressure inside the brain. This increased pressure, in turn, intracranial pressure, it's called, is not good for a bunch of things, including the circulation of blood flow through the brain, and not just blood flow, but also the fluid, the interstitial fluid surrounding brain cells,
mm.
cerebral spinal fluid. It's critically important to how the brain functions. In fact, it's also critically important to sleep. It turns out just in the last couple of decades, we've learned that sleep is critically important for like rinsing or washing the brain, not brainwashing like, classic teaching someone to think away, but brainwashing by eliminating metabolites from the brain during sleep. That's one of the main functions we've learned of non-REM sleep is to rinse the brain of metabolites that accumulate during wakefulness. Now, if
Huh.
you have inflammation in the brain or swelling in there that increases pressure or other anomalies, then that compromises the brain's ability to clear itself of these metabolites during sleep. So sleep quality goes down, and
Mm.
yes, perhaps becomes more interrupted. And those are bad things. And then you do not recover as well from the concussion because your sleep is compromised by the concussion. That's what's called a vicious cycle, which
Right.
they're so common in medicine. Uh, Counterproductive, pathophysiologic, vicious cycles where one thing causes the other that makes the other thing worse, that perpetuates the problem.
Yes. It sounds so hopeless. But it's
No,
not.
it's
It's
not
not hopeless.
hopeless at all. Absolutely not. But it's something that the awareness is everything, education, and then
Yes.
learning how to cope with it and what to do about it, if anything. And we're still learning these things, Bethany.
Yeah. Yeah, it's fascinating. Like there's so much that we still do not know and that we're actively working on learning. And so I appreciate you bringing this knowledge to us. And fascinating that we want brainwashing. That's this is the main thing I'm getting from this conversation is
Yes.
we need to be brainwashed. And it's the cerebral spinal fluid that does that during the non-REM sleep. Is that what you said?
Yes.
Fascinating. Okay. Okay. So, thank you for helping us understand that. So, um, I want to, well, okay. I'm debating about which direction to take this because I have so many questions
Well,
for you.
do you want me to finish answering the question
I
about,
do.
right.
Yes, let's
So
do
that
that.
was the class of patients who had no sleep problems beforehand. And that the entire situation I described to you applies also to the other patients who had a pre-existing sleep problem and then had a concussion.
Okay.
So if they had a sleep problem, they're already not sleeping well, and the concussion sequelae outcomes, the inflammations are only going to make that worse. Whatever was going wrong with their sleep previously, disturbances, um, this and that, source of the cause of insomnia, the concussion outcome immediately exacerbates what was already there,
Hmm.
making the situation, the vicious cycling we talked about, that whole thing even worse. So it's it's far worse to have a pre-existing sleep problem, depending on its severity, than just to go into a concussion with a healthy brain and healthy sleep.
Hmm.
Yes. And then there's the outcomes of concussion that negatively impact sleep indirectly. For example, one of the most common is PTSD.
Hmm.
Concussion is often associated with some sort of traumatic event and very commonly associated with post-traumatic stress disorder. Now, that independently is known to negatively impact sleep. So even if your sleep was healthy, or depending, it may be unhealthy, that PTSD component in many cases, when it's there, is going to feed into these negative pathophysiologic consequences.
Hmm.
So I'm finished answering your first question. That,
I love it. Well, and I think that that is such a good point that there are other things that play into it as well. So it's fascinating. Like we have the physiological impact from the concussion itself, and then other side impacts. And so I really appreciate the just your bringing awareness to all of this,
yeah,
and hopefully people.
PTSD is just one example, by the way.
Yeah. Do you want to
Another
share a
very
few other ones?
common depression and anxiety.
Mm,
The
yes.
concussion by itself can lead to that,
Yep.
which those notoriously interact negatively with sleep. And then you can have pre-existing depression and anxiety before you had the concussion. And then when you have the concussion, yes, again, we've got an even worse situation where all of those things are exacerbated. The depression, the anxiety, and the impacts on sleep. And all of those things affect recovery from the concussion.
Yes.
Yes.
Thank you. And I this is why I feel so passionate about this podcast because I want people to know this. I feel like it's not talked about enough and for people to understand this is why this is part of why sleep can be so impacted and there well just all of the issues that come up from a concussion are so real and they play into each other on so many levels. It's just it is very complicated and hard. So if you're dealing with a concussion and you're listening to this, please know it's real. Like what you're experiencing, there are physiological reasons for it, and emotional reasons. And
Yeah.
the dysautonomia as well is a major thing. The dysregulation of the nervous system in general can impact sleep too. So there's
Yeah.
just so
Bethany,
much
what I
to
like to say about that is to the patients, yes, it is all in your head, but
it.
it's real. It's not your imagination.
Mm,
It's all in your head, and it is physiologic reality. What's going on in there?
yes, absolutely. We should write like put that on pillows or something. It's all in your head, but it's a physiological reality. Um, so
Right.
yeah, so good. So what can be done? It sounds so overwhelming and so distressing. Like there, and it is again, it is real, and there's so many factors to it. But there are things that can be helpful. Well, yes, I have, like I said, I have so many questions, but
Okay. Well, Bethany, I've got your list of questions, that you
yeah,
sent me. And
Yeah.
we can go down that list
We
if you
just go down
want,
that list. I
or you know,
know.
if you're whatever, wherever you want to go with this is
I
absolutely
know.
fine, as you
I want
know.
to I want to jump ahead. Let's jump ahead to some of the like what can be done things before we come back to them, I think.
Absolutely.
Yeah, because I that's where my brain wants to go. It's like, okay, we have all these issues, now what?
Yes.
And then we can kind of touch back on some of these other things. But yeah, what can be done?
Yes, ma'am. Well, it's the good news is there's lots of things that can be done.
Mm,
And jumping ahead a little bit, but going to the cutting edge, if you will. I love preparing for this podcast because it sort of forced me to go back and revisit some things, do some homework, and get up to the current state of the art in the scientific literature.
and I
And
appreciate you doing
one
that.
thing I discovered is a mantra that I strongly believe in, and that is exercise is medicine.
Mm.
I didn't invent it. There's actually a website called Exercise is Medicine from the American Academy of Sleep Medicine. And
Huh.
it turns out that exercise can be medicine for concussion, including post-concussion syndrome, and can facilitate recovery. Now, earlier guidance said to patients, rest, be quiet, be still in the dark, and avoid activity. But some recent research demonstrates that mild to moderate activity, even early after a concussion, can be beneficial. Exercise is medicine for so many things,
Yeah.
including many sleep disorders, by the way, and psychological disorders like depression and anxiety. But for concussion specifically, it's critically important that that exercise not produce any head accelerations or jarring of the head whatsoever. So a stationary cycle, sitting on a stationary bike is probably that type of exercise is going to be what's best for someone recovering from a concussion
Hmm.
because the head is not accelerated at all. It's kept still largely. And that's really important when you're recovering from a concussion. Um, so, exercise, again, pretty recent findings can be helpful even within the first couple days after a concussion to help facilitate recovery.
Yes.
Mild to moderate. And these are things I should emphasize to talk with a doctor about. If your neurologist says don't exercise, then you shouldn't exercise. Okay. I'm not, and I should further qualify my medical credentials. Yes, I was board certified in sleep medicine by the old mechanism as we discussed. But Bethany, I worked as a PhD under the supervision of MDs and DOs. As I said back then, I can't prescribe a glass of water. Okay. Everything I did was as a physician extender,
Mm.
a PhD physician extender in my years of seeing sleep patients. So I
Mhm.
want to emphasize that. I was never independently licensed. Uh, and back to my point of this, listen to your doctors. And if they, for whatever reason, think you shouldn't exercise or whatever, then they, follow their guidance. But I will add, and this is one of my most important, Bethany, most important take-home messages, is for all patients, for any ailment, including concussion, be your own advocate. And that means educate yourself from reliable sources. And that's becoming increasingly hard to do. But I can't emphasize that enough. And we can talk about that some more. Where are reliable sources, how to find them, how to know they're reliable. But that education is your best friend, and not just for you're dealing with concussion, but all sorts of ailments, becoming your own advocate for your own situation by knowing what's going on and talking with your doctor in an educated way about your situation and not just passively absorbing whatever they have to offer without doing your own homework.
And something that comes up a lot on the podcast here and talking to people is that uh, concussion specific treatment is not always top of mind, or like not everybody understands concussion specifically. And so there are people who are being told by their doctors to go, I'm still hearing it, to go and sit in a dark room for weeks or until you feel better. Like, and that's it's so this is why, yes, educating yourself is important and understanding, okay, wait, I heard that exercise is actually important. And within like the general consensus that I have, most updated thing that I've heard of is that it's about 2 days, like 48 hours that it is important to really like take it easy, rest, kind of like imagine you've got the flu and you're just like taking care of yourself
Yes.
and then start building back in exercise and mild moderate activity. Like you want to be actively engaging the brain and doing physical exercise. Movement is so important for emotional and physical well-being and sleep, as we've discussed. So I do
Yes.
appreciate you bringing that point up. So no, listen to things like this, get educated and talk to your doctors about that. And it can be especially hard, I think, for people with a concussion because it's hard for especially at the beginning when they're needing to have these
Yes.
conversations. It's hard
Yes.
to remember things. It's hard to even understand what you're reading. It's hard to be on a screen
Yes.
to research it. It's hard to have the conversations and be like to be the advocate. So just know that it's okay that it's hard and we understand like it's real that it is hard and it might be worth having a family member or a friend or somebody who can help
Yes.
advocate for you, be there with you,
Oh gosh, yes.
take the notes, do the things, and do the help with the research too. So I think that is so important, and I think that the stationary cycle thing is an important thing too. I I've like in talking to people and what I've observed, the like doing walking. I think I'm curious when you're doing your research, does it talk about like jarring being like running? Because I've heard that running can be helpful too, but I know that some people say that it hurts them if they feel like it hurts their head or they're nervous
Mhm.
about running because of that jarring.
Uh,
Did you see anything in particular about that?
I only
Fine if
saw
you
the
didn't.
research I saw used stationary cycling for a very good reason, and
Hmm.
that's to avoid any accelerations of the cerebral spinal system.
Hmm.
And that it seems obvious that you'd want to do that. And so I
Yeah.
love things that seem obvious. It's not always true, but in this case, I suspect that running might be discouraged. And
Uh-huh.
furthermore, cycling, I get going out on the trails or you risk a fall then, no matter how neutral the environment. If you're on a bicycle, that means you're going across the planet at a certain speed and something could happen.
Right.
And one of the most important things, as you already know, is to avoid re-injury. One of the worst things you can do to a brain that's been concussed is to impact it again
Mhm.
anytime, especially soon after that concussion.
Yeah.
It takes you down a very dark path that can actually be lethal in some cases.
Yeah.
So that's why I can't emphasize enough stationary the research on the purported benefits of post-concussion exercise early in the process was stationary cycling, and I would be very cautious to go beyond that, especially with anything that caused head movement of any type. Even rowing, for example, because that involves some neck flexion,
Hmm.
rowing on a rowing machine.
Really
Um,
interesting.
yeah.
Super, super interesting. I think, and I imagine that this is like at the beginning. I think it is, we do want to avoid injury. We do want to avoid a re-injury. And that's why I think like it's important for kids to, or people, athletes to take a break from the sport for a while, right? Like, but we do want to get back to it. Is there, in the research that you saw, were there time frames around getting back and not like not just restricting it to stationary bike things?
Oh, getting back to like what you normally do. No, that's not, I didn't see anything about that.
Okay.
And that would be sort of sport specific.
Yeah.
And there would be situations where I'm going to say boxing. Okay. You probably just never want to do it again in your life, like ever. And
Yeah.
then other
I
things, maybe, yes, getting back to road cycling, that type of thing. That would be sport specific and also patient specific. Everybody's different. That's
yeah.
one of the key things I learned as a sleep medical caregiver. And it's really important to remember that we have science and I love it. I believe strongly in it, but it's about populations and means, averages within those populations. And then there's everybody, all the
Right.
individuals that made up those curves, those averages.
Mm.
And you must honor the precept that every patient is different, everyone's situation is different, and you need to approach them individually about their situation. Yep.
Yes. Amen to that. Absolutely. And I think just as the occupational therapist in me is like, wait, but yeah, we want them to participate in their meaningful activities. We need them to be able to get back to things. But especially at the beginning, I think it makes a lot of sense to do the stationary thing. And then the point of all of this is to help you re-engage in life. Like
Yes.
you want to take the rest, pull back from the things that will potentially re-injure you, but continue getting movement that and the exercise that will help with the brain and the body's functioning. And it's just, yeah, there's so much that plays into it all.
Yep.
Um, with, I'm curious, well, is there more that you wanted to say? I love that exercise is medicine. I imagine there's a lot of other stuff that we could talk about. I'm curious though, is there a difference in what people should, quote unquote, should be doing if they have trouble getting to sleep versus staying asleep versus sleeping all the time and not feeling rested? Like, are those different?
Absolutely. Very different in
Okay.
many cases. And let me start out by saying insomnia is almost always a symptom of another problem.
Hmm.
Insomnia is very rarely a primary disease. It's almost always caused by something else.
Hmm.
So when we saw sleep patients, it was about going after the cause, identifying the cause as much as possible. And this is another general medical concept. Anything you have wrong with you, you always want to, as much as possible, identify the primary cause and go after that instead of treating a symptom. This is
Yes. Yes.
general rule, please. It's
Which is
not
why
always followed, but yeah,
so
go ahead.
important for concussions, especially. So I love that you said that because I think so many times, sometimes people don't even realize they had a concussion. They're just like chasing after help for each individual symptom. But even if they know they had a concussion, a lot of treatments are like, oh, you're having this symptom. Let me work on this thing. Let me work on this one thing. And they're not looking at the overall picture of, oh, it's because of this brain injury. Let's work on healing your brain. And it requires a lot of different
Yes.
things. So I really appreciate you bringing that point out.
So for concussion patients, the inability to go to sleep is a tricky one. Um, it could have to do with the post-traumatic stress associated with whatever caused the concussion. It could have to do with just the depression slash anxiety associated with having had the concussion and the neurocognitive deficits they're experiencing, the reduced, oh, the brain fog is the colloquial term.
Mm.
It can be intensely frustrating to come into or go through life with a very highly functioning brain, uh, and then to have this situation where all of a sudden they just can't think well, and then they're conscious and on the planet and still trying to do their job or run their family or be a friend or a husband, wife, whatever, but it's not working well. And so that can lead to, yeah, serious depression, anxiety, which are associated with difficulty falling asleep.
Mm.
And again, the pre-existing conditions before the concussion can contribute to all this, and then the concussion makes them even worse, as we've already discussed. And then it's a sort of an aside, but in uh, in my experience, seeing patients, one of the most common causes of sleep onset insomnia, which is the difficulty falling asleep at the beginning of the night, is something called restless legs syndrome. And we don't need to go into exhaustive detail about that, except to say that it's really common and underdiagnosed, underrecognized, and I think, in my opinion, and based on literature, also one of the major causes of insomnia. Insomnia being a symptom of this restlessness, this difficulty falling asleep because you just can't stay still and you don't know why. It's
Huh.
extremely common. One of your not to divulge too much medical information, but do you have a relative who we talked about years ago who
Yes.
had symptoms associated with this that we observed at one time when he was napping there on the couch? So
Yes.
that
I
was
know. I know it well. So
interesting
how
moment in time for me back then.
that's so
So
funny.
anyway, sleep onset insomnia, right? And then sleep maintenance insomnia. Again,
Wait, sorry, can I pause you?
yeah, of
Before we
course,
go into
please,
sleep maintenance
please,
insomnia.
anytime, always,
Um,
yes,
and I appreciate you defining this for us because I was going to ask you like what is insomnia, but there are both of those count. There's the sleep onset and the sleep maintenance. Is that what you called it?
yes.
So is there anything that can be done for restless leg syndrome? Because that's just a really interesting point. And I wonder too, a lot of again, the brain controls everything. And after a brain injury, there are a lot of things that can happen physiologically within the musculature of the body too that can be impacted. So I wonder if restless
Yes.
leg syndrome, I haven't, this is the first time it's been brought up. Yeah, I'm just curious if that's something that, like, what can people do if that's the issue that they're dealing with?
Right. Back to our friend, exercise. It turns out exercise is medicine for restless leg syndrome. And
Really?
here's a myth I'd like to dispel. Even in from reliable resources, you'll still hear the advice to never exercise late in the day, late afternoon or evening, because the myth is that it will reduce your sleep quality. There are multiple studies that have demonstrated that not to be true, but
Hmm.
it's still controversial. So I don't mean to be saying I'm the last word on this, but it's back to the individual. And the point is this: if you're having problems with insomnia or restlessness at night or having trouble falling asleep, don't be afraid of evening exercise, mild to moderate activity. Don't, do your own experiments. Know your body and listen to it and
Hmm.
listen to the answer to your experiment. Now, everybody knows if you go play full court basketball for an hour and a half and then try to lay down and go to sleep, it's not going to go well. Duh. But I'm talking about mild to moderate activity that stops at least 2 hours before you're going to bed. That can be helpful for restless leg syndrome. We've already talked about recent data suggesting benefits for concussion recovery. No question at all that even in healthy, normal people, exercise improves sleep quality.
Hmm.
Exercise and sleep are like these beautiful siblings that just work so well together, doing the dishes and vacuuming and cleaning the house and everything.
Yay for
Um,
siblings who get along.
yeah, I know it's amazing. Um, so, right. Did
Okay,
that answer
that's
your question?
yeah, yeah, thank you. That's fascinating. Okay, yeah, let's talk about the insomnia, the maintenance insomnia.
Sure. So that's the difficulty maintaining sleep. You can go to sleep at the beginning of the night just fine, but you wake up during the night and then you have trouble going back to sleep. And this might happen a few times. And sometimes you don't even know what's waking you up. Sometimes you do. Maybe you had a bad dream. Maybe a dream associated with a PTSD problem, a recurrent dream based on your history of, trauma, of mental trauma.
Mhm.
Um, so why does that happen? Well, you have PTSD, okay? And what does that have to do with concussions? Well, the concussion, again, back to the problem with the brainwashing, if you will, or cleaning our brains during sleep. What the functions of non-REM sleep, um, that isn't going well in people with brain inflammation, including from stroke, uh, concussion, whatever might be causing that. So they could have their sleep disturbed by any of those things. And once it's disturbed, then you're awake.
Mhm.
Now, for some people, that's not a big deal. They quickly and easily go back to sleep. But for others, especially those with depression or anxiety, once they're awake, it's a problem. And
Mhm.
they're going to have trouble falling back to sleep because their brain starts working. And it starts working on, yeah, not fun things.
Mhm.
But it shouldn't be working at all, except on sleep at that time. It should be going back to sleep and continuing what sleep does for us, the many healthy, wonderful things. So those are the things that can go wrong. Now, back to the causes, the mechanisms. We talked about restless legs and just general restlessness sometimes being a cause of sleep onset insomnia. The most common cause of sleep maintenance insomnia is something called sleep apnea.
Mhm.
And that's these repetitive periods of choking during sleep that are extremely common. Perhaps, well, probably more common than restless leg syndrome in terms of sleep disorders in the general population. Sleep apnea is an epidemic associated with our obesity epidemic
Mhm.
because obesity is one of the main risk factors for sleep apnea. You don't have to be fat to have sleep apnea, but yes, it's a contributing factor.
Mhm. So with um and so is that likely the same thing for it's just interesting that if somebody was not having trouble with this prior to it and then having a brain injury, Is sleep apnea something that they could have developed, do you think? And I don't know if you would know this. Sorry, I'm just like throwing this out at you.
No, it's a good question.
Or are there other things that are waking them up in the middle of the night?
No, no question. The concussion per se can be the source of sleep disturbance. I'm just
Mhm.
talking about potential causes of sleep maintenance insomnia
Mhm.
and whether it pre-existed or not. That's, of course, up to the individual patient. But can I think the crux of your question is, can concussion cause sleep apnea? I'd have to do a lit search on that. I'm unaware of anything like that. I guess it's theoretically possible.
Right.
I'm happy to look it up right now for you. Uh, but
That's okay. We can look it up and maybe you should put it in the show notes. It's an interesting thing. But I some other potential things that I've heard could be connected to the waking up is if again with the nervous system being on high alert all the time, if it has a hard time getting into that parasympathetic rest and digest state, then it's harder to fall asleep. But it's also like if you're I don't know if you're overly sensitive to sounds or if you like your brain hasn't turned off all the way and so it hears something that usually you would be in a deep enough sleep that it wouldn't disturb you, but like small things can disturb the sleep in ways that you uh wouldn't normally be disturbed by if your nervous system is kind of off. And I've This was fascinating to me. At one of the clinic that I worked at, they worked with a guy who was it was something, and I'm not going to be able to describe this perfectly. I'm not going to pretend to understand it fully myself, but I thought it was a really interesting concept that his sense of like proprioception, knowing where his body was in space and like what upright was was thrown off a little bit, and so
mm,
his body didn't recognize necessarily when he was laying down that that was the position he was in, and so it didn't
mm,
recognize that it was time to sleep. Like that, I think those are cues. Like our body position can be a
yes.
cue to our sleep, and so again, there's just so much. It can be so complex as to how how sleep is impacted by the impacts of a concussion. So anyway, I just thought those were really interesting.
Oh, that's absolutely fascinating.
Yeah, right.
Not to digress too much, but it takes me to another topic. Concussion, well, the inner ear has what's called otoliths in it, the structure of the inner ear. And those otoliths sit on the membranes of the inner ear and tell us which way's up.
Yes.
Concussion is knocking the head around, which can affect the otoliths and their function and how the brain senses what the signals they're providing. Back
Mhm.
to your patient, doesn't know which way is up, lies down and doesn't know he's lying down. Almost certainly, if you did a microanalysis of his inner ear function and you looked at his otoliths, they're probably jarred loose from their moorings
Mhm.
and no longer sending reliable signals to the brain for it to interpret as which way's up. Yes, we sleep lying down because our muscles relax and we have to, and that's a good thing.
Mhm.
Um, but for someone, this is great, Bethany, because I'm pretty confident this is unexplored. These are unexplored questions. How do impacts of a concussion on the inner ear and the otoliths affect our ability to sleep, just in terms of perception of what's up?
Yeah.
What's up with that?
What's up with that, right? It is so fascinating. It's so fascinating. And so I guess if someone's listening to this and is like, that might just be one more area to consider in getting some maybe kind of vestibular kind of treatment by somebody who understands these things well and understands how
Right,
the
and there are treatments for that, for
yeah,
Meniere's syndrome and for vertigo and other things. There are specific maneuvers they can do to help reseat the otoliths. It doesn't have to be surgery. There's things you can do.
yeah.
But in the context of concussion, you just want to be careful. Um, what else, Bethany? I've got 1,000 things I could go off anytime about a bunch of them that I've done, learned and
Yeah,
for preparing
yeah,
for this.
I'll set you free. You just go, man. I'm
Okay,
gonna
well, let's talk more
I'll-
about sleep and what can be done about sleep to help with this.
Yes, please.
Um, Tilting the bed slightly head up. Back to intracranial pressure, the pressure inside the head. Okay.
Yeah.
Um, Anything that gravity right now, we're sitting up. Gravity is pulling body fluids downward in our body, including cerebral spinal fluid, which is
Hmm.
decreasing the pressure inside of our head, which for someone with a concussion is a good thing. So when you lie down, gravity is no longer pulling fluid downward in our body. It tends to go headward.
Mm,
And for someone with increased intracranial pressure, ICP, increased pressure inside their head from the concussion, that can be a bad thing.
mm.
So tilting the bed slightly head up, hypothetically, and there's some research I think to support this, hypothetically could help reduce that increased ICP from recumbent posture during sleep, and
Yeah,
therefore help relieve their concussion symptoms at night.
fascinating. And you said raising the bed, not necessarily a pillow that changes the head
Right, that's very
position, but that's
important.
that's your neck being involved there. So yes.
Yes,
Okay.
because that takes me to another thing, which is spinal alignment. In my reading and preparations, turns out that for a couple different reasons, just having the neck aligned directly over the spine and the head is important for people with concussion during sleep, because any sort of torsion, any sort of bending of the neck can not only affect the venous outflow from the head by constricting or limiting flow from the jugular veins, but also affect cerebral spinal fluid drainage in a negative way. Meaning,
Mm,
again, anything you do to limit outflow of fluid from the brain is going to increase pressure there, which is not your friend
right.
recovering from a concussion. So keeping
Right.
your head aligned, if you sleep on your side, that means pillow support. If you
Okay.
sleep on your back, that means limited pillow. You don't want your neck flexed a lot on a big pillow, pushing your head forward.
Hmm.
And the literature I read said to discourage people from sleeping prone, meaning on their stomach, because in that situation, your head has to be turned. If you sleep directly on your stomach, by definition, to breathe, your head has to be turned to one side or the other. So
Yes.
I'm a stomach sleeper, even with my pressure mask. I treat my sleep apnea with CPAP. Even with that, I still sleep on my stomach. But if I had a concussion, Bethany, I would make myself not sleep on my stomach
Mm.
because I would want my head straight. Yes, I want
Yes.
my head on straight, Bethany. Please,
Please.
please.
Uh, that's that's so fascinating. Actually, I love that you're bringing this up because I had a conversation with someone who had been told not to sleep on their stomach, and I didn't know why. So I appreciate you helping me understand that. That's so interesting. If they, I'm just curious, like when you say like if what if they had one of those like massage beds where you could just like sleep
Right.
straight, would that be okay?
It would. I
Okay.
mean, in my opinion,
Yeah, the point
uh,
is just to keep the spine straight. So if, yeah,
yes.
interesting. Okay. So many, yeah, so fascinating. Thank you. That's so interesting. Okay, keep going. Let's hear more.
Right. Well, I mean, back to the insomnia complaint. You always want to go after the primary cause. You asked about treatments for restless leg syndrome. There are also medications. I have all this stuff, so it's great. I know a lot about it as a patient and as a former practitioner.
Mm,
There's medications for restless leg syndrome. There's other, non-pharmacologic treatments, non-drug treatments besides just exercise. It turns out just getting enough sleep is helpful. Now, because in some people, restricted sleep can exacerbate their restlessness. Interesting.
mm,
Now, back to the sleep maintenance insomnia. If you have sleep apnea, you sure as heck want to treat that, and not just for recovery from your concussion. There's a huge list of other problems sleep apnea causes that you do not want. And
mm,
treating it is your friend. It's preventive medicine. Treating sleep apnea, arguably, is the most powerful preventive medical tool we have for sleep complaints. In my opinion,
mm.
when they're centered on not breathing well at night. That's what sleep apnea is. Is you're just not you're repeatedly choking during your sleep. Not healthy, and certainly not healthy for recovery from a concussion. The literature has demonstrated that.
Is snoring a sign of sleep apnea? Like how is snoring related to sleep apnea? Or are they not?
Right. Not all people who snore have sleep apnea, and sleep apnea is not necessarily associated with snoring. For example, in children with sleep apnea, they often don't snore much at all. Interestingly,
Hmm.
um, so it's a mixed bag there, but in general, it's very common for people who snore to have sleep apnea. Yes, that's an extremely common association. And snoring by itself means your breathing is restricted, at least to some extent. So it's also not a healthy situation, but not nearly as bad. Just snoring but breathing evenly is not nearly as bad for you as sleep apnea, which is repetitive restriction of your breathing that disrupts your sleep. They are different things.
Hmm. And what can be done? I mean, I know CPAP machines where it's kind of forcing air in all the time, right? It's like,
Yeah,
is that is that the best treatment for sleep apnea? Are there other things that people could do?
absolutely. There's other things. No question. There's it's no question that air pressure is still the best way we have to hold the airway open during sleep. It's so reliably effective. It's just a matter of what mask is comfortable that the patient can wear all night, and then how much pressure do they need, what type of pressure. But there are definitely other treatments for it. Weight loss, if somebody's sleep apnea is only associated with weight gain. In older women, sleep apnea is often associated with postmenopausal uh, situations. So hormone replacement therapy in older women can
What?
relieve their sleep apnea.
That's so
Yes.
crazy. Why is hormones are the worst. I mean, they're great. We're grateful for them, but also what the heck? How does that impact it? I don't understand.
Oh gosh, this is a tangent, Bethany, and we could go down it if you want. But basically,
No, just like super like high level summary of it. We don't have
estrogen is it, the female hormones, estrogen in particular, are protective from sleep apnea. No question. Even with that, obesity aside, premenopause, men are more predisposed to having sleep apnea than women. Now, postmenopause, the women lose that hormonal protective effect. So even, and this is one of the tricks about, or one of the tricky areas of sleep medicine is you'll have an older woman come in. She slept great her entire life. She goes through menopause, and all of a sudden her sleep turns to crap, and she doesn't know why.
Hmm.
Well, she's thin and otherwise very healthy. It's because her sleep. She developed sleep apnea when she lost the protective effect of her female hormones post menopause, and that's the
That's
potential benefit of hormone replacement therapy in that population.
that's so fascinating. And I actually am glad we're having this discussion because hormones are also something that can be impacted by concussion. Again, the
Yes,
brain is impacting everything and controls all of the release of all of those hormones. And so, and even apparently sometimes depending on what if the woman is premenopausal, she has not gone through menopause, depending on what phase of her cycle she was in when she had the concussion, that can impact how the concussion impacts her as well. So that's a really interesting thing that I never considered, that the hormone piece could impact the sleep um, issue. So
yes,
thank you for bringing that up. So interesting.
yeah, you bet. Again, a bit off topic, but so let's get back to the topic. What else can people do about their sleep? Melatonin, you hear a lot about that. It's something our brain naturally produces, and we should allow our brain to do that. One of the great, one of the best ways to suppress melatonin secretion, let's say you don't want any melatonin from your brain. One of the best ways to do that is to view a lot of like electronics in the evening or evening hours, including things with a lot of blue light or bright light.
Hmm.
Our brain secretes melatonin normally after sundown as the light goes away because that's part of how it prepares to go to sleep. And it turns out melatonin is also a powerful antioxidant, which is our friend when we have an inflammatory condition like concussion.
Hmm.
Okay. But again, if we want to suppress our natural melatonin secretion in the evening, then getting on a screen of any type, especially with a lot of blue light or bright light coming out of it, is a great way to do that. And like a prescription for insomnia. And that's true in other ways too. How to have insomnia? Well, get on that iPad while you're in bed and
Hmm.
get on TikTok for quite a while or
Hmm.
Facebook, whatever. I don't care. All of them. And there's multiple different things going on there. One of them is the light suppressing melatonin secretion. So a patient might say, well, I use the filter. I have just warm colors coming through that screen. Well, there's still interaction going on. There's still mental stimulation that's some of it interactive. You're playing Candy Crush, even with the blue light filtered out, whatever. That's keeping you up. Hello? And anything else that you find stimulating like that.
Hmm.
So electronics are not the friend of sleep, and that includes TVs in the bedroom. Just no
Mm.
fan of that. We didn't have those in our sleep lab. Patients complained bitterly, then they went right to sleep. There's
That's
actually
very
research showing that people will claim that they need the television on to go to sleep, Bethany.
Mhm.
And it turns out in a sleep lab environment anyway, you can do the test with and without television, and they will fall asleep more quickly with the TV off than with it on. These are people that will stand on the desk ranting and raving that that television must be on for them to fall asleep.
You've seen it.
Yes, yes. And so um, politely disagree with those patients about that situation because, anyway, enough about that. Protect our sleep from electronics. That's not just about concussions. It's about everyone, and it's especially about children. But that's another soapbox
Mhm.
that could take us, another 3 hours.
Yes. Okay. Yes. We will pause on that one, but I appreciate you bringing up the kids specifically. Is there anything, well, yeah, on the topic of kids in general, is there anything that's different for recommendations for sleep for kids versus adults in helping them get to sleep or stay asleep?
I saw this interesting study. I found it fascinating. They compared recovery from concussion in some high school kids who had the concussion during the school year versus had the concussion like before summer or during the summer.
Hmm.
The kids who had the concussion during the summer recovered much more quickly and well than the kids who had the concussion during the school year. Now, Bethany, you tell me why that is.
I have some ideas, but I'm not sure. I mean, there's so much going on with school as far as like the demands and they're constantly having to be on, like they're constantly performing and doing things and
Yeah.
like that's I would guess that has something to do with it, but
Well, what's the short answer?
ability to rest during the summer and not as much,
Yes.
that's it.
Ability to sleep, time to sleep,
Time to sleep
time,
specifically.
their social structure, everything about their life gave them time to sleep during the summer that they did not have during the school year. And
Hmm.
that was the key critical factor that facilitated their recovery from their concussion.
Mm. Yep. Yep. Well, and I would also throw out there, I am guessing that they had the ability to rest during the day as well, even if it wasn't full on sleep. But yes, I'm sure that both like that played into it as well. Like,
Yes.
yeah, so interesting. So
Yeah, I did. I found that study fascinating.
yeah, yeah, thank you. So, and I imagine like that would be, well, I guess for adults who it's hard when there's for both students, for kids and adults, it's never convenient to be having to recover from a brain injury, I guess. So, sleeping, well, okay, what about I'm gonna ask you,
Yeah,
uh, you're talking about melatonin, like ideally our brain is producing the melatonin. What are your
right.
thoughts on supplements? Because I know that a lot of people I've heard from all of the sleep experts, like people who actually study sleep, I, I'm pretty sure my all of them have told like the things that I've heard has been don't take supplemental melatonin. But everybody else talks about it like it's the best thing ever. So tell me what
Yeah,
your opinion is on it.
right. I have strong opinions on it. And the number one opinion is to do I already said, have the brain make its own. But if you want to take supplemental melatonin, it's just like a lot of other things. Uh, Number one, listen to your body, know your body. And number two, do the experiment and start with a low dose. Furthermore, start with a dose well before bedtime. This is not a medicine to take. Like if you're going to go to bed at 10:30, taking it at 10:30 is not is it going to have maybe a limited benefit for helping you fall asleep, especially. Actually, it will
Mhm.
have zero benefit for helping you fall asleep if you take it when you lay down. Yeah, that's
Okay.
zero because it takes medicine's time to get in our system. A lot of patients amazingly don't seem to understand that. But anyway, take it well before you go to bed. Be aware of your body. Start at the lowest possible dose. And the thing that the discouraging factor, one of them about melatonin is In some people, it can cause headaches. Now, headaches are arguably the single most aggravating symptom of concussions.
Yes.
So to give a patient anything that might give them a headache or worsen their existing headaches seems like a bad idea. Uh, just putting that out there. But again, everybody's different. So if the patient gives it a try at a low dose and finds it helpful when they take it well before bedtime, and they don't wake up with a morning hangover from it, meaning they just don't wake up well in the morning, they feel groggy or unhappy or whatever, which is another common side effect of melatonin,
Mm.
then, if they feel that it helps them and that they aren't having problems from it, then it's good. But if they're taking it and getting headaches or worse headaches, and if they're having trouble waking up in the morning when normally they may not, or if it's causing problems of any kind that they can isolate to the melatonin, then they shouldn't take it. Absolutely not. Please. But the importance of that is doing a clean experiment. Like anything you intervene with, you do the you
Isolate
apply
it.
the whatever it is, exercise, melatonin, sleep habits, but then you take it away and see what happens. And if whatever symptom you're trying to correct with it goes away when you're using it and then comes back when you don't use it, whatever the thing might be, well, that's a clean experiment as long as you didn't change any other variables at the same time.
Yes.
We're all scientists, but we got to do clean experiments. Yeah.
Yes. Amen. How about magnesium? That's another one that I've heard a lot of people talk about in relation to helping with sleep.
Dang it, Bethany. I'm going to be honest. I haven't heard about that. I didn't do any research on
And
it.
I
I
didn't
don't
I
have
didn't
any
warn you that I was going to ask that question.
medical. I didn't have
Guess
any
what?
medical
Well,
history about it. I can find out that answer for you and pretty quickly. But I will say I will go back to what I just said. Give it a try
mm,
at low doses. Start at low doses. Okay, for anything, exercise, um, whatever it might be.
yeah.
And then if you feel like it's helping, but you want more, you increase the dose. We want more of that benefit, whatever it might be.
Mm,
Um, but for prescribed medicines, number one, take it according to prescription. In no way, Bethany, do I ever want to say anything about any of this that would countermand a doctor's prescribed orders.
yes.
I can't emphasize that enough.
For prescriptions or supplements. Like I think it's a good idea to
Yes,
talk to your doctor about all of those things.
no,
So
it's
yes.
an essential idea.
Yes. Yes, absolutely. And thank you for your honesty on the magnesium thing. I would definitely like if we're like it's killing me that we're running out of time because I feel like I could talk to you for
Well, there's one
all
more
day.
thing there's several more things that are really important, but there's one that I need to talk about before we run out of time.
Okay. And then we'll bring you back. Are you okay with doing another one of these?
Oh, sure, yeah, I'd love to.
Okay,
Absolutely.
perfect. Good. We'll definitely bring you back because I feel like there's so much that's important to understand about
My
sleep. But
my notes are extensive, and we haven't covered even one-fourth of them.
okay,
So,
perfect. Well, we'll have lots of more conversations. So tell me the other like main thing that we need to know though before
yeah,
we
I
end.
want to talk to you, Bethany, and your audience about the military population because they're a special case that experiences a lot of concussion problems. And I had an extensive conversation with my good friend, Colonel Robert Carter, in the Army, who's a highly experienced scientist and soldier. And he has personal experience in these areas as well as scientific research
Mm,
background in them. And the good news is, well, the bad news is we have soldiers who are injured, a lot of them.
yes.
But the good news is we learned so much. And the military, the Army has been very forthright about this. It's a bit of a microcosm, or it's kind of like football in a way. Like 40 years ago, you have a concussion, nobody gives a crap. They
Yep.
do
Yep.
not care.
Yep.
And by the way, there's a whole population of older patients, yes, mostly men right now, who have a history of concussion, and they have no idea because nobody ever diagnosed them with it. But they had pretty tough problems back then, and it was just they were just told to go back in. Well, the military is a microcosm of that. Say 20, 30 years ago, you have a concussion, it's sort of like, well, so what? Uh, but now there's a heightened recognition of this problem, and it's a good thing, the heightened recognition, because it's leading to a lot of research, very good research on concussion. And we could this is a whole nother podcast, but Dr. Carter shared a lot of that information with me, and it's important to emphasize that it's not just about operational situations, it's about training, like
Mhm.
military training, etc., leads to a bunch of things that can cause concussions, and they're paying attention to that now. And
Good.
again, trying to you have to train soldiers to fight. This has to be done, but how to do it to not impact their brain literally uh,
Right.
is very important. And I just need to bring that up because it's a huge part of what we currently know about concussion and what we continue to learn. And thank you.
Thank you so much. Yes, and as you're talking about that, it reminded me too of like of training within sports as well. Like I know that a
Yes,
lot of concussions happen during practices. And so I think again,
yes,
I think awareness is being increased and that's really good. And I just hope that that continues on. Like we need to be protecting our brains as much as possible, especially in the preparation for the actual event, whether it's military or sporting, that where injury could also take place, but we want to protect ourselves as much as possible before, during,
yes,
and after that. Um, so I appreciate that and definitely think that that's an important point that yes, there are back in the day, and even, I mean, when I say back in the day, like even 15 years ago, people,
yes,
this was not, I think there was more awareness, but especially further back as we go back in time, there was less appreciation for the impacts of what a concussion can do and help for people who are struggling with it. And I think that's why a lot of people self-medicated with drugs and alcohol. And there's a lot like, and the, all of the emotional issues that come with these things and the PTSD. Anyway,
yeah,
there's a lot to it and a lot that I think probably could be helped with concussion treatment that, again, people might not even realize could be helpful for them because they might not even know that they're dealing with a concussion. Um,
right.
so, and I'll just throw out here as well, concussion treatment, uh, as far as like the multisensory kind of experience where you're addressing the vision issues and the vestibular issues and the emotional issues, like all of the things that come along with it. If
Yeah,
you can get treatment for that, that can help with the sleep as well.
absolutely.
And again, sleep will help with the recovery too. So again, it's those uh combined things that make a big difference and they play into each other, but addressing those underlying concerns of the concussion itself can be
Yeah,
very helpful with recovery.
creating a positive therapeutic
Yes.
cycle of
Yes.
healing to counteract the negative vicious cycles of pathophysiology of interacting ailments. Bethany, very well said. Thank you.
That's that I you summarized it perfectly. I was just gonna say very well said to you too. That's so funny. Um, Perfect. Okay, well I like yeah. We are gonna go ahead and stop this, but I this is definitely like a pause on the conversation because there's so much more that we could talk about and I think are really important things to discuss in regards to sleep and concussion. So thank you for doing all the research you did and getting yourself up to speed so you can help get us up to speed on what's going on in the world of concussion and sleep. Anything else that you want to make sure gets said on this podcast before we head out?
I think the main thing is just there is a lot more. So, Bethany, I already look forward to our next discussion. It doesn't have to be your next podcast, but sometime in the near future, I hope we can have a follow up on this. And then just to reemphasize the importance of education, of patients educating themselves from reliable sources, and that's becoming increasingly difficult these days.
Yeah, let's
So I
let's do
just
do that before we jump off. Can
oh
you give us a little information of where like how can people know that what they're looking at is reliable? Because you're right, it is hard these days to know what is true. And there's so much information out there. How can we know if it's accurate or not?
yeah, good science it comes from peer-reviewed literature, and that means other scientists have looked at what you've done. Scientists that have no relationship to you other than they operate in the same general field of research, and they've looked at your work and they've said, "Yep, this this is well conducted research and deserves to be published." It may disagree, by the way. it may provide findings that disagree with the other scientists' viewpoint, but if they're an open-minded, good scientist, they're going to still say this deserves to get out there. That's the beauty of science. The dark side of it is people really just putting out their own opinions as science these days and calling it hard science when it actually has not gone through peer review and is not legitimate published research on a group of people or whatever. And there's so much of that going on these days, labeled as good, hard, valid science when it's not. And these can be influencers or isolated wannabe scientists or politicians or whoever. And I just can't emphasize enough the importance of finding reputable resources. And here's the deal. It's getting difficult, Bethany, because of what I talked about. So I'm not Medline, PubMed. That's your database. That's the database of real research. Now it's by scientists for scientists. So it's a little bit hard for a layperson to draw usable information from PubMed, but not that difficult. And then a lot of the universities and institutions like Mayo Clinic, organizations like the American Academy of Sleep Medicine, these types of organizations, reliable research, good guidance. Sure, there's things that are going to be controversial, like the whole exercise thing I talked about, exercising in the evening. The American Academy of Sleep Medicine still, I believe, I haven't looked at their website recently, but the American National Sleep Foundation, some of these, they may still recommend against evening exercise, which I believe good science has demonstrated can be healthy for a lot of people. Anyway, that's the beauty of science, is that controversy can exist, but it also can be resolved by additional research. Mm-hmm. So, sadly, I'm going to say our government isn't anymore always the best resource for reliable information. I don't like saying that. I don't like knowing it, but I'm just being honest. But these organizations like the National Science or National Sleep Foundation, American Academy of Sleep Medicine, and then Johns Hopkins University, universities in general, PubMed, those are still good, reliable resources in the large majority of cases. Lots of others.
Okay.
That's the best I got.
Thank you. Thank you. And thank you for doing your research on it so you can share it with us. I appreciate that very much.
You bet.
And thanks for being here. I look forward very much to our next conversation. We are not done with this. So yeah. Thank you, Uncle Don.
Absolutely. Thank you, Bethany. It's been fantastic fun.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.